Today we continue with our pharmacology lesson where we look at drugs that are used within the cardiovascular system. Prototype drugs affecting the CVS or the cardiovascular system come in a range of a lot of drugs, and some of the drugs we might have discussed them in our lessons in PowerPoint. Otherwise, the major diseases that are related to the cardiovascular system include heart failure, arrhythmias, angina, and hypertension. Let us discuss heart failure and the drugs that are used in heart failure. A heart is a unique organ that starts functioning before birth and continues till death occurs. The heart acts as a pump to supply blood and thus oxygen and nutrients to all the body tissues. Heart failure is a complex, progressive disorder in which the heart is unable to pump sufficient blood to meet the needs of the body. Heart failure is due to the impaired ability of the heart to properly fill with blood or eject blood. It is often due to abnormal increase in blood volume and intestinal fluid. Let us now look at some of the prototype drugs that are used in heart failure. We have renin-angiotensin system blockers, we have beta blockers, we have diuretics, we have directive vasodilators, and we have ionotropic agents. Some of the examples under renin-angiotensin system blockers include captopril. Okay, or you find that you say ACE inhibitor, angiotensin converting enzyme inhibitor, or losartan, which is an angiotensin receptor blocker. Then examples of beta blockers include propranolol. Diuretics are some of the drugs that we discussed under drugs of the genitourinary system. So you can always refer to that lesson that we have already recorded. Then we have direct vasodilators like sodium nitroprusside. Then we have ionotropic agents like digoxin and digitalis. So these are ionotropic agents. Let us understand more on these drugs and angiotensin converting enzyme inhibitor, ACE captopril. So ACE inhibitor captopril is an agent that blocks the ACE activity as enzyme converting angiotensin converting enzyme activity. That is what we are referring to when we say ACE. So as ACE, that is as the angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, which is a powerful vasoconstrictor. So captopril inhibits the agent or block the ACE activity. The ACE activity here, we are looking at ACE converting or angiotensin converting enzyme, that is angiotensin 1 being converted into angiotensin 2, which is a powerful vasoconstrictor. So these agents they also diminish the rate of bradykinin inactivation, which is a vasodilator. Action on the heart. Captopril and other ACE inhibitor decrease vascular resistance and blood pressure. Adverse effects. Some of the adverse effects recorded for captopril include the dry cough, abdominal pain, skin rash, hypotension, and renal insufficiency. ACE inhibitor should not be used in pregnant women because they are fetal toxic. Pharmacokinetic. ACE inhibitors are absorbed in the GIT. The presence of food may decrease absorption, so they should be given on an empty stomach except for captopril. Losartan. Losartan is an angiotensin receptor blocker. Losartan and other angiotensin receptor blockers are competitive antagonists of angiotensin type 1 receptor. Losartan have the advantage of more complete blockade of angiotensin action. These agents do not affect the bradykinin level. Action on the cardiovascular system. All the angiotensin receptor blockers approved for treatment of hypertension constitute some of these drugs that fall under angiotensin receptor blockers. So all the angiotensin receptor blockers approved for treatment of hypertension, this agent is most useful in heart failure as they reduce the blood pressure. Pharmacokinetic. All drugs are orally active and require only once a day dosing. Losartan undergoes extensive first-pass hepatic metabolism, and all drugs are highly plasma protein bound. Adverse effects. Angiotensin receptor blockers have similar adverse effects with angiotensin converting enzyme inhibitor. However, angiotensin receptor blockers do not produce a cough. Propranolol, which is a beta blocker. So beta blocker drugs in an adrenergic antagonist were discussed in another chapter, so I'll still come back to this one. Diuretics were also discussed in another chapter. Let us look at directive vasodilators like sodium nitroprusside. Vasodilators are used in the treatment of heart failure and hypertension. Vasodilators cause relaxation of smooth muscle or blood vessels by direct action. Sodium nitroprusside is a mixed vasodilator. Pharmacological action or mechanism of action. Sodium nitroprusside is an emergency drug which acts directly to relax smooth muscles of both arterioles and veins. Pharmacokinetics. Onset of action occurs within 1 minute of intravenous administration. Therapeutic use. Sodium nitroprusside is used for treatment of heart failure and hypertension. Adverse effects. Adverse effects may include headache, nausea, and vomiting. Let us now look at ionotropic agents like digoxin or digitalis. Positive ionotropic agents enhance cardiac muscle contractility and thus increase cardiac output. Mechanism of action. These agents increase cytoplasmic calcium concentration that enhances the contractility of cardiac muscle. Pharmacological action of digitalis. Digitalis has direct and indirect action on the cardiovascular. The important actions are increasing contractility, conductivity, and the rate of the heart. Digitalis increases cardiac output. Therapeutic uses. Digitalis is used for treatment of congestive heart failure. The drug is effective in right, left, or both ventricular failures. In bad retirement heart, the drug may not be so effective. Adverse effects. Adverse effects may include nausea, vomiting, headache, and blurred vision. With drugs under heart failure discussed, and now let us now look at anginal drugs. Angina pectoris, that is pain or discomfort in the chest, pectoris, that is chest or breast, is one of the major symptoms of heart disease. It is sudden, severe, pressing chest pain radiating to the neck, jaw, and arms. It is caused by coronary blood flow that is insufficient to meet the oxygen demand of the myocardium, leading to ischemia. Types of angina. Angina occurs in the following forms. 1. There is a stable angina or typical angina. 2. Unstable angina. 3. Variant angina. Let us now try to expand on what we mean on these types of angina. So we start with stable angina. It is the most common form of angina and therefore is called a typical angina pectoris. It is characterized by a burning and heavy feeling in the chest. It is produced by physical activity, emotional excitement, or any other cause of increased cardiac workload. Typical angina pectoris is promptly relieved by rest or nitroglycerin, which is a vasodilator. Unstable angina. Unstable angina lies between stable angina and myocardial infarction. In unstable angina, chest pain occurs with increased frequency. The symptoms are not relieved by rest or nitroglycerin. Unstable angina requires hospital admission. Variant angina. Variant angina is a common pattern of episodic angina that occurs at rest and due to coronary artery spasms. Symptoms are caused by decreased blood flow to the heart muscles due to the spasms of coronary artery. Variant angina may be relieved by coronary vasodilators such as nitroglycerin and calcium channel blockers. With that discussed, let us now look at we have discussed the drugs that are used in angina, okay, and we have also discussed the types of angina. Okay, so we have discussed types of angina and we have discussed the drugs that are used in angina. So let us now look at drugs that can be used in angina. So anti-angina prototype drugs. We have organic nitrate, beta blockers, and calcium channel blockers. Under organic nitrates, nitroglycerin is an example of the drug, and under beta blockers is propranolol, and then under calcium channel blockers we have verapamil. Okay, so now let us look at in detail at an organic nitrate, which is nitroglycerin. Organic nitrates and nitrites used in the treatment of angina pectoris include nitroglycerin. These are simple nitric and nitrous acid esters of glycerol. This compound causes a rapid reduction in myocardial oxygen demand followed by rapid relief of symptoms. They are effective stable and unstable in a stable and unstable angina as well as in variant angina pectoris. Pharmacological effect. Nitrate decrease coronary vasoconstriction or spasms and increase blood flow by relaxing coronary arteries. In addition, they relax veins, decreasing preload and myocardial oxygen consumption. Nitroglycerin, which is also known as glycyl trinitrate, relaxes vascular smooth muscles by their intracellular conversion to nitric ions and then to nitric oxide. Pharmacokinetics. Nitroglycerin is commonly given by sublingually or via a transdermal patch because it has a significant fast metabolism. Adverse effects. The most common adverse effects of nitroglycerin and other organic nitrates are headache, postural hypertension, facial flushing, and tachycardia. Beta blockers as some of the drugs to use in angina. This one, we discussed the profile of propranolol. And on calcium channel blockers, we have also discussed, and then the example of the drug to be given here is verapamil. Let us now look at antiarrhythmic drugs. Any cardiac rhythm other than the normal is called arrhythmia. For example, cardiac arrhythmias may cause the heart to beat too slowly, then we call that bradycardia, or to beat too rapidly, we call that tachycardia, or to beat irregularly, causes of arrhythmia. Most arrhythmias arise due to abnormal automaticity or due to defect in impulse conduction. Prototype drugs that may be used in arrhythmias. We have class 1 sodium channel blockers like Quinidine. We have class 2 beta adrenoceptor blockers or B blockers like Propranolol. We have class 3 that is a potassium channel blockers like Amygdalin. And then we have class 4 calcium channel blockers like verapamil. Let us now look at class 1 and arrhythmia drugs or sodium channel blockers, quinidine. Quinidine is an alkaloid and shows many of the actions of quinine, such as antimalarial, antipyretic, and working against depression. The action on the heart is more marked and specific as compared to quinine. Pharmacological action. In general, quinine is a cardiac depressant. It decreases automaticity, excitability, and conduction velocity, and depressed contractility. Mechanism of action. Quinidine blocks sodium channels. It reduces the maximum rate of depolarization. Okay, so that is phase 0. Depresses spontaneous phase 4, diastolic depolarization, slowing conduction, and prolongs the effective refractory period of arterial and ventricular. Therapeutic use. Quinidine is used in the treatment of a wide variety of arrhythmias. Pharmacokinetics. Quinidine is rapidly and almost completely absorbed after oral administration. It undergoes extensive hepatic metabolism, forming active metabolites. Adverse effects. Quinidine may cause sinoatrial or ventricular ventricular, they may cause SA or VA block or a systole. A toxic level of the drug may induce a ventricular tachycardia, nausea, vomiting, and diarrhea as some of the common adverse effects. Propranolol as class 2 and beta adenoceptor blocker. This one, beta blocker, we have already discussed it under anti-angina drugs and anti-hypertensive drugs. Class 3 potassium channel blockers, Amygdalin. Amygdalin contains iodine and is related structurally to thyroxine. It has a complex effect showing class 1, 2, 3, and 4 actions. Its dominant effect is a prolongation of the action potential duration and the refractory period. Amygdalin has anti-angina as well as anti-arrhythmic activity. Therapeutic uses. Amygdalin is effective in treatment of severe refractory supraventricular and ventricular arrhythmias. Despite its side effects, amygdalin is the most commonly employed antiarrhythmic drug. Pharmacokinetics. Amygdalin is incompletely absorbed after oral administration. The drug is unusual in having prolonged half-life of several weeks, and it is distributed extensively in near-adipose tissue. Adverse effects. Amygdalin shows a variety of toxic effects. Some common side effects are gastrointestinal disturbance, tremor, dizziness, photosensitivity, muscle weakness, skin discoloration that can be caused by iodine accumulation in the skin. Verapamil as class 4 or calcium 2 channel blocker. Mechanism of action. Verapamil inhibits the slow channel calcium ion transport across the myocardial cell membrane. It also reduces intracellular calcium concentration in smooth muscle cells of the coronary and peripheral vasculature. Pharmacological action. Verapamil depresses SA and AV nodal function. Okay, so we're talking about sinoatrial and on the AV bundle nodal function, that is electrical conductivity. So slow AV conduction is its major action, making it useful as an arrhythmia agent. It reduces coronary and peripheral vascular resistance. It increases coronary blood flow. Verapamil increases myocardial oxygen supply by increasing coronary blood flow. Simply, we can say verapamil has anti-arrhythmia, anti-angina, and anti-hypertensive properties. Pharmacokinetics. Verapamil is rapidly and almost completely absorbed after oral administration. It undergoes extensive first-pass metabolism in the liver, and it is highly bound by plasma protein. Its half-life is 3 to 6 hours. Therapeutic effects. Constipation is the most common side effect. Nausea, vomiting, headache, weakness, and gastric disturbance may occur when given. Verapamil may cause severe hypertension and bradycardia. Okay, so with drugs and arrhythmias discussed, let us now look at anti-hypertensive drugs. Hypertension is a group of symptoms characterized by elevated blood pressure, cardiac output, and total peripheral resistance determining the blood pressure. Antihypertensive therapy involves non-pharmacological intervention as well as specific drug treatment. Dietary sodium restriction, exercise, weight loss, behavior are some of the factors that may affect the blood pressure and may need to be modified to control blood pressure. Some prototype of drugs used in hypertension. So we have diuretics, we have beta blockers, we have angiotensin converting enzyme inhibitor, we have angiotensin receptor antagonist, we have renin inhibitors, we have calcium channel blockers, and we have alpha blockers. So we have already discussed diuretics, we have discussed propranolol, we have discussed ACE inhibitor, we discussed the angiotensin receptor blockers, alpha blockers, okay? We have discussed them in adrenergic antagonist, and we have also discussed calcium channel blockers. So this has been our lesson on drugs that are used within the cardiovascular system. So to appreciate the drugs that are used in the cardiovascular system, we first establish some of the diseases that may affect the cardiovascular system. And some of the diseases that affect the cardiovascular system include heart failure, arrhythmias, angina, and hypertension. Some of the groups that are of drugs that are found within the drugs that are used within the cardiovascular system can be remembered in A, B, C, D, H kind of fashion like in alphabetical. We have A for angiotensin converting enzyme inhibitors, B for beta blockers, C for calcium channel blockers, okay, D for diuretics, and then we have hydrochlorothiazides, or we have thiazide groups of drugs. So those are some of the drugs that are used, and it's important that we can also remember other prototype of drugs that are used within, let's say, in treating heart failure, like ionotropic agents, like digoxin, okay, and some direct vasodilators like sodium nitroprusside, and also those drugs that are used in angina. Okay, so you find that in angina, some of the drugs that are used in hypertension can be used, and then we also have typical drugs that can be used in angina. When we discuss angina in this lesson, we establish that we have three types of angina: stable angina, or typical angina, unstable angina, and then we have variant angina. And some of the drugs that can be used include organic nitrate, beta blockers, and calcium channel blockers. Then prototype of drugs that are used in arrhythmias, we discussed that we have class 1, class 2, class 3, and the class 4 groups of drugs. So I thank you most sincerely for following up on each and every part of this lesson in understanding drugs that are used within the cardiovascular system.